So in general, the more complicated the condition, whether an individual condition or the set of conditions, the more complicated that is, the more relevant having good data is to the situation. So diabetes is a great example, but so is the Medicare patient. So the Medicare patient, typically by virtue of their age, they are already in a situation where they have multiple chronic conditions. Now, the term chronic conditions is very interesting because, in effect, 50 years ago, those conditions would have been your terminal condition. So some people say today we are having populations that are far more sick than in the past. But ironically, the reason is because we're actually getting better at treating and managing patients, people. And the condition like a heart attack or a cancer that might have killed you in the past is now one of your chronic conditions with which you live for years further. So as a population becomes more complicated because of the virtue of their longevity and the complexity of their disease that occurs, the information to help coordinate that becomes that much more important. In a different way, the case is similar for the Medicaid patient. The Medicaid patient is complicated not necessarily because of their age and the number of different underlying diseases and comorbidities, but because of challenges of access to care and other socioeconomic barriers that make it such that conditions that do arise can become more complicated to manage. So the expansion of an understanding, or as we refer to it, the insight that is gained on the patient, can make a dramatic difference in these Medicare and Medicaid populations.
Great.
So we have a lot of really intelligent people around the world. Physicians and researchers and academicians have arrived at wonderful treatments, wonderful diagnostics. One of the challenges is understanding which are best, what are the best combinations, and what are the best care plans and course of actions to take in the multiple different permutations of disease and comorbidity. Said another way, if we had a highly effective comparative effectiveness research and outcomes research that would allow for the optimal care plans to be introduced for these complex situations. So what in a particular study might be an analysis of just high blood pressure or cancer outcomes or diabetes outcomes becomes more complicated when it is a cancer patient with diabetes and hypertension who is 50-year-old or maybe 70 years old, might be male, might be female. The beauty of large data sets gives us the deeper understanding of these complicated, these real patients that individual studies of a specific disease historically have not looked at. So these real-world data sets of massive size allow us to create highly accurate and highly effective care plans and intervention plans that are more effective for real-world people.